A very good evening to all my listeners. I am Dr. Sonali Jagati, OBG resident at SCV Medical College, Cuttack, Odisha, having secured an All India rank of 3546 in NEET PG 2021. So today I am back with another episode of Coffee Pe Charcha. Today's topic of discussion will be on a very important and routinely used drug in our labor rooms and antenatal ward, that is corticosteroids. We prescribe, and our seniors also always advise us to prescribe this corticosteroids mainly to our preterm and who are in anticipation of a preterm delivery. So let's know more about this drug. So what are the names of the drugs that we routinely prescribe? These are the betamethasone or the dexamethasone. These belong to the corticosteroid group of drugs. Now, what are the uses of these drugs? As we very well know, these help in fetal lung maturation, but they also are very protective against colitis, that is NEC, and intraventricular hemorrhage. Now, what are the dosage? Now, betamethasone can be given as 12 mg, 2 doses 24 hours apart, and dexamethasone is given as 6 mg, 4 doses 12 hours apart. Routinely in India, we prescribe dexamethasone. Now, there's always a controversial thing and a doubt in the minds of the residents that which one is better. Now see, the efficacy of both are same, but betamethasone requires a lesser dosage. If we go into the depth of the pharmacology, betamethasone is available as betamethasone acetate plus phosphate salts. Now, what we get in India is only the phosphate salt. Now, the acetate is the one which makes it into lesser dosage. So, if we have only phosphate, it is not going to be of much use to us. So, we usually prescribe dexamethasone, which is 4 doses. If betamethasone is available, then yes, of course, that can also be given. Now, very importantly, next is the guidelines. The RCOG very well has given the guideline that any pregnancy where we are anticipating delivery between the gestational age of 24 to 34 weeks should be given a course of corticosteroids. Also, the ACOG also gives a guideline that between 34 to 37, irrespective of the membrane status, if we are anticipating delivery, preterm delivery, then a corticosteroid course can also be given after explaining the risk benefits to the patient. Also, the NICE guidelines tell that between 34 to 36 weeks, we can give a course of corticosteroids whether it is suspected, diagnosed or established preterm labor. So, as a whole, we should remember that between 24 to 34 weeks of pregnancy, any time when we are anticipating a preterm delivery, we have to give a course of corticosteroids if the delivery is anticipated within 7 days. If the course has been given but the delivery did not take place within 7 days, then another course can be repeated after 7 days whenever we are anticipating the delivery. So what are the contraindications for corticosteroids? Chorioamnionitis is a big contraindication to corticosteroids. Now, can it be given in a GDM or diabetic patient? Yes, corticosteroids can very well be given in a diabetic or a GDM patient, but yes, RBS monitoring has to be done. Now, when is it highly efficacious? After 48 hours of the second dose. This short session on corticosteroids has helped you to gain some knowledge about this very important and routinely used drug. Goodbye and take care.